I will call this meeting to order.
Look at him getting salty.
We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the regular trustee meeting, March 23rd, 2021. Minutes of the special trustee meeting on March 26th, 2021. Minutes of the regular finance meeting on April 20th, 2021. And a check report March 9th, 2021 through April 8th, 2021.
I make a motion to approve the consent agenda as presented, items A through D.
Second.
Have a motion by Dr. Brown, a second by Dr. Simon to approve the consent agenda as it was presented. Roll call vote, please.
Gasper,
Yes.
Randall,
Yes.
Simon,
Yes.
Brown,
Yes.
Bach.
Yes.
Next item is the CEO's report. Candace.
All right. I apologize, it's a little warm in here, huh? We'll make this quick. Turn the lights off, I don't know. So if you notice at the top, welcome back to two familiar faces. Shelley Keplitz is back part-time working in OR, and Tabitha Nutter is back with us working in nursing. We are super excited to have both of them back. It's been a while since we've seen those two friendly faces, and super excited to get two great nurses back to work for us. IT report CrowdStrike has been deployed. This is antivirus software, a little higher level than what we had in the past, and it seems to be doing a great job and not having any issues here lately. Novi 4 is a software that was deployed probably nearly about a year ago. This is software that tests our employees. Quit smiling at me. Tests our employees to make sure they're not clicking on things they shouldn't be clicking on, and I failed today. So I get to remediate and do a learning module to remind me of things not to click on. So it is, I thought it was pretty good. I failed today. So anyway, we're happy to be able to have that kind of software in place. If you'll notice, it says we had 417 emails, 59 clicks, and 4 attachments open, which probably only having 4 attachments opened is probably pretty good. So anyway, yay. Marketing, Logan Merriweather was a student through Northwestern doing an internship with us. Spent time in our marketing IT department, and we've actually hired him on full time. He is getting married later on this summer, and will be relocating, but will continue to come up every once in a while and do our marketing remotely. So if you notice more activity on our Facebook page, that's Logan's work, and he's doing a great job. So happy to have Logan with us. You can see our swing bed and inpatient activity going on, as well as ER. Recently, the Northwest Technology Center have their LPN students back out doing their site rotations, and we also have had DNV here last week. DNV is the accreditation company that we use instead of having state survey. This is an accreditation company that actually comes out every year. With state, you get a survey about once every 5 years if you're lucky. And so DNV was out last week, much harder survey this year, focusing on some COVID activities and infection control things. So I expect that we will have several non-conformities, is what they call them, and we have not received that report back yet to take a look at those. So looking forward to getting that back. Physicians clinics have been pretty busy. Winoka and Freedom Clinics have been doing well. Darlene Bainbridge was on site last week as well. I said DMV was here last week, it was actually 2 weeks ago. Because Darlene was here from SQSS, which is our quality system. She usually comes on site once a year and helps get us a little further down the road in using that system. It helps us to stay on track with our quality initiatives, activities. It helps us during our survey process to quickly be able to locate things that the surveyors are looking for. So we were glad to have Darlene on site. And one of the things, if you remember, you saw our employee satisfaction surveys last month, I believe it was. One of the initiatives that we are working on for 2021 is improving our communication. And one of the things that I sat down with Darlene and asked her to help me with was how can we make sure that we're doing all we can do to communicate with our employees, and kind of explain to her, you know, I told you we were using GroupMe. Many of us are using GroupMe to keep in communication with those that we supervise. And several of the department heads use that. But what seems to be lost is if they're not, the huddle notes, we huddle with our managers in a group once a week, and then Regina and Chris and I huddle with those that we supervise once a week as well. So twice a week we're meeting with those people. And that communication seems to be good, but sometimes it doesn't get passed on down to the ones that they supervise. So what Darlene suggested is we, instead of emailing the huddle minutes out, we're going to start putting them in SQSS, which forces them to sign off on those notes, those huddle notes, when those are put out there. So if nothing else, it'll help remind them that yes, we are communicating, you've signed off on those, you can go back and look at them at any time instead of getting buried in email or not checked. So we're excited to get that started. Revenue cycle is going much better, as you probably have heard. People are getting lots of phone calls, and unfortunately some of those phone calls are coming before they've ever gotten a statement, an invoice, and we realize that is happening and we apologize. Unfortunately, the company that we had hired to take care of that process was obviously not doing their job, and we are working through that process of rectifying if patients have made a payment and it's not reflected. We will work with them to get that taken care of. So hopefully all of those calls have, at least the initial call has been made, not that they've been in contact with the patients, but all of the initial calls have been made. So they assured me that we've gotten through that portion of the process. Obviously, there's still lots of work to do on that, but we are making progress, and I feel confident going forward with the company that we have that we will not be in this situation again. As Kim and I were chatting earlier today, we're starting to see good movement on payments coming in. So those processes are working. We finally have reports that we can wrap our arms around and see what needs attention, what's falling off. And I have to say, for the first time that I've worked here, that I feel like we're in a good position going forward to take care of those things. Does anybody have any questions for me? That's the end of my report.
Any questions for Candace? If not, Candace, thank you, and I would entertain a motion.
I make a motion we accept the Share Medical CEO written report for April 27, 2021.
Second.
I have a motion by Jay Randall, a second by Kim Ball, to accept the Share Medical Center written report for April 27, 2021. Roll call vote, please.
Randall.
Yes.
Simon. Yes. Brown.
Yes.
Ball.
Yes.
Casper.
Yes. All right. Again, Candace, thank you. Next is the CFO's reports. Chris?
I'll start off with,
Cash balance, $785,000, which is 22.8 days of operating expenses without depreciation. And through this, I'll just kind of hit some of the bigger numbers that we kind of look at each month. I won't read off everything. If you guys have any questions about it, feel free to ask. Our AR, accounts receivable, 5.8 million is pretty high. That's higher than we want it to be. I believe that this has something to do with the issues that Candace had mentioned in her report with some of the billing company, but also our collection agency that we used to use, as well as our statement agency. I think kind of that they all kind of play together on this, and this is something that we're kind of working on, trying to get under control. The AP balance, our accounts payable, $560,000, which again is high for the month. Usually it's not over 200 or 300,000. This was more of a timing issue. We were trying to start paying on our camera system. We had that invoice, and that was sitting in our accounts payable, and the next day it came off. So it looks high, but it was more of a sitting out there. The next day it got paid, so that dropped back down. More or less just had to do with trying to pay on our security system, which would be paid with COVID money. Gross patient revenue was up $275,000. You can see with the patient days why it was up. Had 120 days in March compared to 16 February, so doubled in March what we had done the prior month. Office visits were up as well, 1,588 in March to 1,347 in February. So on that next page, you can kind of see inpatient and outpatient where those fall. With that doubling up the inpatient days, what that gave you in March compared to February as well, and the clinic office visits, how that hit the outpatient revenue account. Operating expenses, $499,000, which is an increase of $134,000. That also had to do with our security system, getting that in there and trying to get that paid off. We're starting to see those security system bill coming in. We still have a couple other pretty good invoices coming in. We should still have another $100,000 for a portable X-ray that'll come. That'll have to do. It'll be paid with COVID money as well. So there are a couple other items that are still coming up that we're waiting on invoices. They'll be pretty high, but most of those still are stimulus money will be paid with that. So nothing to be worried about. The other. Let's see. You can see what the net income was for the year or for the month. $654,000. If you look up about the middle of the page, you can see the other operating revenue was $968,000, which is very high. That was our PPP loan was finally forgiven. So all that came over and was turned into other revenue. It had been sitting out there waiting to get forgiven, and it's now been forgiven. So we now have that money at our disposal. Any questions about the hospital? There's nothing there. I'll look at the nursing home. Nursing home is doing pretty well. Almost $300,000 in cash. Their accounts payable, only $18,000, so they really don't have a lot of expenses sitting out there. Kelly does a really good job of managing those expenses. You kind of see that from month to month on his operating expenses and where they've been at. Their gross patient revenue, $360,000, almost a $20,000 increase from the prior month. Once again, you can look at his patient days, 1,172 compared to 1,027. And I'm sure Kelly will kind of touch on this. I'm going to guess with that number being 360,000 that they had a decent amount of swing bed or skilled, and that's why it's higher than. Typically they wouldn't have over $350,000 a month, but these last few months they've had some more skilled nursing, which higher reimbursement rate for that, so that brings in more money for them, which is good. Operating expenses, decreased to $30,000 from the prior month. Like I said, Kelly does a good job of keeping his expenses under control. Salaries and wages down $31,000, which gives them a net profit of $87,000. So you can kind of see on the next page on the income statement, kind of what I was talking about with their skill. You know, in October, November, December, you're $250,000, $280,000. January, February, March, you're $400,000, $300,000. And I think that's when they have a big hit for our skilled nursing. I'm sure they'll touch on that some more. But his operating expenses pretty much stay in line every month. So he does a really good job there. They're looking really good. Any questions there? And my favorite one is the Homestead. Because the Homestead, I said it last month, and I say it about every month, they do what they need to do. Their revenue is, up $7,000, but, sometimes they may be up or down a few thousand here or there, but they hold steady almost every single month. And they do a really good job keeping their operating expenses in line also. So every month they're showing that profit every month, and they do a really good job. And we don't have to worry about them too much. They kind of are just over there doing their thing, making their money, and we just pat them on the back and tell them good job. So I wish I could talk more on the Homestead. I don't want people to feel like I'm leaving them out. They're just so consistent. There isn't a whole lot to say about it. Any questions?
No questions for Chris? All right, thank you.
At this point, every month, I kind of review what's going on with the stimulus funds we've received from the government, and how we're spending those funds. If you turn back to the CFO Board Report tab, after the financials that Chris just went over, after page 9 of the balance sheet, after page 9, there's some pages that run landscape. And first one says at the top, Share Medical Center and Hospital use of COVID-19 stimulus funds. And as I've told you in the past, I've looked at lost revenue, looked at operating expenses by the week since the pandemic started. On page 2, you can see in March that we're continuing to trend downward as far as our weekly COVID-related expenses, which I think is a pretty good indication that we haven't had hardly any COVID show up at the hospital. I don't know when we had our last positive test, but it's been a while probably. So we're working towards getting this behind us. Under payroll expenses, March 12th, we paid our final COVID payroll, so that's all been taken care of. There were no capital expenses paid for during March. On the next page, at the top, total use of stimulus funds, $2.762 million so far is what we've expended at the hospital. We still have money available where we still have expenses to pay. I'm showing the additional COVID-related expenses to pay after March 31st. List the first 3 weeks of April there, show what was paid weekly for COVID-related expenses. As Chris said earlier, we paid for the installation part of our access control project that we did over here. Still have about $195,000 to pay on that, and a portable x-ray of about $110,000. So still got some things to pay. Things are definitely starting to wind down. I've done some reporting to one of the state agencies that we receive funding from. They've required quarterly reporting, so I'm done with that particular agency. Health and Human Services remains quiet as to how we're going to report all this, what we're going to be able to keep, what we have to pay back, that sort of thing. Not hearing anything. So sometime in the future, I suppose that will clarify itself. Turning back to the convalescent home tab. Do you have any questions about any of that on the hospital? Convalescent home, after the financials that Chris just reported, turn back to some landscape pages. Here again showing the amounts we've gotten that were designated for the nursing home. The revenue, that loss of revenue that we reported, operating expenses, payroll expenses. Again, we paid the final payroll on March 12th for COVID-related payroll. And on the next page, I'm showing that we still have a couple of things to pay for, the balance of the what we call the Wonder Control Project at the nursing home and the balance on the Access Control Project. One is to keep people, either keep people out of the nursing home or control access to the nursing home to try to keep COVID out of the nursing home. The other is to keep patients from wandering off and getting exposed to COVID and coming back and bringing it with them to the nursing home. So those are both related, both those projects are related to the pandemic, and we're being reimbursed through stimulus funding. Does anyone have any questions about any of that?
Any questions for Steve? If not, Steve, thank you. Next item, medical staff, executive committee. Is there anything to report there? I see there's no credentialing. No? Okay. Our next item then is the discussion action to enter into executive session under section 25 OS 307B1 to discuss the employment, hiring, and appointment of a physician to the staff of the Share Medical Center.
Make a motion to we enter executive session under section 25 OS 307B1.
Second.
Have a motion by Dr. Brown and a second by Dr. Simon to enter into executive session under section 25 OS 307B1. Roll call vote, please.
Simon? Yes. Brown?
Yes.
Ball?
Yes.
Gaspard?
Yes.
Randalls?
Yes.
Okay, it's a discussion and action to employ, hire, and appoint a physician to the staff of the Share Medical Center. I would entertain a motion.
What, did y'all forget it?
Make a motion to approve,
10 minutes to
to approve extending the employment contract under item number 6
Who?
to Dr. Evan.
Who?
Dr. Evan?
It'd be item A for Scott.
We're gonna step back out. You guys are
Sorry, my bad, under item 8. There you go.
And would that be effective on July 1st?
Effective July the 1st of 2021.
Way to pull that out.
Second.
Great job.
Have a motion by Kim Ball, a second by Jay Randalls to employ Scott Evans, DO, effective July 1st to Share Medical Center. Roll call vote, please.
Brown?
Yes.
Ball?
Yes?
Gaspard?
Yes.
Randalls?
Yes.
Simon? Yes.
We should hire
Are
more dogs.
all your board
Not to
board
rescue
meetings,
guys.
board reports this fun?
No, we're just gonna rescue that.
Yeah, last month we couldn't get it right.
That was a
We have improved. At
We
least we got
actually
it
made
done
it
this
into
meeting.
executive session this month. Next month we'll do it seamlessly. All right, next item is coffee. Do we have?
Do we have coffee minutes? Oh, no, she sent me a text, and I was in a meeting and did not respond to the text, and I just read it like 15 minutes ago.
Okay.
We don't have to, because we had a survey.
All right, under improvement to patient care, we have contract review and then also several other items. If you go back to patient care.
Probably patient care, or the validation calendar, looks like we have 3 contracts that were reviewed and compliant. Dietitian's report is attached as well. Are we on that?
That's the second one. Yeah.
Next item is the policy for the lactation breastfeeding break policy. We have renovated a room across the hall. You may have been standing in it, I don't know. Yes.
I don't have any need for it, but it was nice.
It was nice, right? Well, next time you have a baby, you go in there. We got a few employees that may take advantage of that.
So basically, we need to adopt this policy
Yes.
to accommodate these mothers. And we previously had no policy, so we're making one.
That is correct.
Okay.
No room or policy.
Is there any questions about this policy?
We actually have a mom that is pregnant with twins, so that's pretty
wow.
exciting.
I make a motion to approve the new lactation breastfeeding breaks policy.
Second.
We have a motion by Dr. Brown, a second by Jay Randalls to approve the new lactation breastfeeding breaks policy. Roll call vote, please.
Paul,
Yes?
Casper,
Yes.
Randall,
Yes.
Simon. Yes. Brown.
Yes.
And then the next thing on the agenda is the action to approve or disapprove a revisions report dated March 22nd, 2021. What you're looking at, again, is those policies and procedures that we have been uploading to SQSS so that our employees have all of our policies and procedures in digital format to be able to access them 24/7. So you can see those have been being put up and approved to go online, so that's what you're looking at. Those are the latest ones.
These are not new, they're just the ones
Correct.
we've already approved at some point in time, and they're just now being put up on there.
Correct.
All right.
I move that we approve the revisions report dated March 22nd to 2021.
Second.
We have a motion by Dr. Simon, a second by Jay Randalls for the approval of the revisions report dated March 22nd, 2021. Roll call vote, please.
Casper,
Yes.
Randall,
Yes.
Simon. Yes. Brown.
Yes.
Paul.
Yes.
Okay, next is the Share Convalescent Home Report. Kelly.
Well, I'll start with what Chris commented on with our skilled days. And our skilled days, we're at 387, and that continues to be up. We had typically run in the neighborhood of 75 or so skilled days a month under normal circumstances, but we have had an increased amount of skilled days, and of course that's a Medicare Part A service, and so it's reimbursed at a higher rate than the Medicaid rate for long-term care. So it is good for business when we are able to take care of that higher acuity resident and meet their needs that way. Sometimes they go home because of what their condition is. That they might have come from home and maybe they weren't able to get into a swing bed somewhere, so it's the same level of care as swing bed, essentially, just in a long-term care setting. We did have one discharge in March. We did have one death in March as well, but we also had 3 admissions, which those are primarily, I think 2 of the 3 were people coming off of Part A skilled nursing services and going into long-term care. We are working on some quality initiatives with regard to implementation of our electronic health record. As of last Monday, we went live with the clinical portion, the majority of the clinical portions of our EHR. We have a skin and wound module that we still need to go live with, and we have a nutrition management module that we need to go live with yet, but those are coming soon. We're also currently working on our general ledger and accounts payable modules to have the whole offering of the point-click care. It's not everything they offer, but it gets us a well-rounded health record that ties into our business office, and it's so far things are going well. We'll plan to go live with the general ledger and accounts payable in July when we start the fiscal year. And it seems like we're on track to do that. We started early working on it, so that should happen. We did have the engineer on site at the end of March to review our facility and with regard to the HVAC needs and system replacement. We don't have a report yet back from the engineer as to what the recommendations are, but he did, look through all the rooms and took all the measurements, and so, part of what we're going to have at minimum is we didn't have blueprints of the entire facility, but we will have when he's finished, and we'll also have the plans for the HVAC system. I feel like we've put back enough cash into our refurbishment fund that this is going to be a project that we should be able to do without financing it, hopefully. So keep your fingers crossed for cost-effective solutions that we can tackle. Steve mentioned our access control and our roam alert system. Those are in place and they're working pretty well. We've had some issues. Sometimes when the wind blows really hard, it causes those doors to come apart from the magnet, and so it's like somebody's trying to get out, but it's really just the wind. And so we've had a few issues with that, but we've got a lot of those adjustments made to where we're not dealing with phantom alarms anymore. And we no longer have the over the intercom system where it yells at you that there is somebody code alert at every door in the building. And so that's nice. I'll talk a little bit about employee satisfaction. If you look at the bottom of the first page of my report, that's kind of all the major categories of satisfaction that we look at on a monthly basis. And what I get out of that is that our employees are really satisfied with their employer and the company. But when you look at the overall job satisfaction, they're not so enamored with probably the work that is entailed. And so we're trying to figure out ways to make work more enjoyable for them. But I feel like we're doing a really good job of having that team/family atmosphere that our employees appreciate, and they find meaning in their employment and love their jobs and that kind of thing. We do all those bolded areas. We do measure across the company that we use for employee satisfaction is called We Care Connect. And so when we measure across their entire benchmark, we're exceeding what they show for their entire database. We've had some morale activities. We just ordered some t-shirts, and we're going to be rolling out what we're calling the Share Standard of Care. And so kind of a quality improvement initiative that we're going to be rolling out here pretty quick. And t-shirts to go along with it, and hopefully we'll see, some better patient outcomes and also more job satisfaction as well. We also think that with the electronic health record, we're going to see more job satisfaction also, because it really has been a move to be more efficient with the work that the nurses have to do and the aides.
Kelly, when is you project your next survey?
Well, anytime.
Okay.
Um,
It'll be interesting to see how
It
that
is,
goes.
yeah, it is, it's overdue. We didn't have one in 2020, and they were focusing on infection control and COVID-focused surveys, and we did have 4 of those surveys throughout the pandemic, with not very many, nothing that would be considered a bad deficiency. And really only, I think out of the 4 surveys, I think there were only 2 deficiencies total. And those were primarily dealing with documentation. So the EHR would have eliminated both of those deficiencies had that been in place. So we're feeling pretty good about surveyors coming. We know they are surveying at other facilities right now, their standard surveys. And so we feel good, but I guess it's a cautious optimism, because we do have a lot of areas for improvement that we've been working on over the last year and a half or so. That's about it. I will tell you that we've been looking into transportation grants, and I guess through that process of seeing what was available to us, I was asked to sit on it's the Northern Oklahoma Regional Transportation Organization that serves 16 counties and mostly in northwest Oklahoma. And they have a technical committee where they seek people with experience in aging and underserved populations, as well as a few other categories. And so I was asked to serve on that, and their board did approve my appointment last week. So I'll start working on that, and that should, hopefully it does something good for us. It's not just another meeting to attend, but anyway, because I love meetings. But that did happen. So, any questions?
Any questions for Kelly? If not, the Homestead Report?
Homestead, like Chris said, everything's, runs pretty smoothly over there. We have had an increased interest. In the last couple of weeks, I think we've had 2 people move in. Due to health needs, I know there's going to be at least 1 person move out. So, that's a net +1, but it's, always going to be that way over there. They are working on, they're planning their first out-of-town trip that they've had since the pandemic started, and so they'll be taking 3 of the residents up to the Plum Thicket in Kiowa, and they'll have to draw for spots and see who gets lucky. But they're excited to be able to, leave the confines of the homestead for a little bit, and we're excited for them. Of course, they've been able to come and go through town and that kind of thing, but we haven't had any out-of-town travel until now. I think that's about it. I need to tell you that the community garden has begun, and the residents are I don't think they're working in the garden, but they love watching. And so that's been really great. I want to go back on the garden note. I want to go back to the nursing home report. The Key Club came out last week, and they worked a lot harder than I did, and a lot longer than I did. But they dug up weeds and
We did a great job.
yeah, there was a pile of brush and leaves that Hala probably couldn't see over. It was a lot of work, and those girls did a great job. And so we were really appreciative of that help and the leadership that they had. But we have a resident that really loves being out in that butterfly garden, and he supervised the whole thing and told them what was a weed, what wasn't a weed, and don't pull that, but pull all that, And we even got some things taken care of we've got an inner patio that's not accessible from outside of the building, but if you come through the lobby, you can get to the inner patio. And got a little work out of them in there as well. So lots of gardening stuff going on at both campuses. So
Good deal. Any other questions? Kelly, thank you. Anything from the foundation?
just briefly,
Before I let you go.
we do have scholarship applications that are being considered right now. I think it was through part of the fishing. I didn't get the original notifications, or I looked past them, but I didn't want to have to take remedial courses and not opening emails I shouldn't open. But we do now have the scholarship applications as of today, and I've sent them out to the foundation board members for evaluation, and so we'll be choosing this year's AHA scholarship. We got 5 applications, 4 from Alva, 1 from Burlington.
Okay, cool. All right, thank you again. Next, St. Anthony's Report. Bridget, glad to have you.
Thank you for having me. Some of the things that have been on our radar, sounds like y'all have been kind of honed in on those too. Just, I was just, the ladies during break, I said, I'm not even sure why I'm even complaining about this, but the state has gone out and started surveying, and I mean, why it felt like a real survey while they were there, when we got our report back, there was only one thing on it, which is highly, highly unusual. So I guess I was probably trying to say that I was a little disappointed in the process. So I'm glad that y'all are using D&D so it keeps you on your toes, because you're clearly following all the rules and regs, which some of the hospitals are not going to have that same opportunity. And so I worry, if they get a little strict next go around, 3 to 5 years, that we might be in a little trouble. So we're going to have to be a little bit more diligent all on our own. One of the other things is the managed Medicaid, which I'm sure I saw on the website too, that y'all had posted some information on that. So just an extra little push to, if you have the opportunity to talk to anybody about it. I'm sure Candace could provide you with some information for talking points. We've been working very hard on that. Joe Hodges, who's our regional president, and Tammy Powell, who's president of St. Anthony and Bona Joint, they have been spending a lot of time at the Capitol with Jimmy Durant, who's our political advisor. We actually added an additional advisor to our team this year just because of some of the things we're going to have to tackle this year. So I just wanted y'all to know that we are up there fighting very much against it.
To keep Oklahoma from outsourcing Medicaid to those bigger companies out of state to manage our Medicaid.
Yes. So I was just reading another article today that came out with that. I guess their profits, this third-party company that they're looking at, made like $699 million last year. And I know in Jimmy's template he had put and pointed out the fact that their CEO got a $22 million bonus last year. So that's just never really been what Oklahoma's about. So
They project that to make their goals, they will have to cut in the first year 40% of services to women and children, pregnant women and children. 40% of services will have to be cut for them to meet their goals.
So they can make $600 million.
yeah, so they can make
Does it seem like this is something that is gonna
I mean, the governor is pushing.
The governor's really
I
pushing
mean,
it.
it's his thing, he wants it, and he's been pushing. I think you'll see his comment in his last article was that, I mean, he was just put out the fact that, that we were trying to accommodate the Oklahoma Hospital Association. I mean, that's, all of our hospitals in Oklahoma are represented through the Oklahoma Hospital Association. I mean, he just blatantly said that he's upset that we're trying to placate Oklahoma Hospital Association, so.
Basically saying we'll pay for it.
Yeah, yeah. So, you know, our shop funds, I don't think anything's been decided on those as well. And the shop funds have been, you know, critical to our hospitals being able to continue to move forward, help pay for some expenses. And
it puts 340B at risk for some of the hospitals?
yes, and I mean, there's just so many pieces to it that are just wrong, and it's just, I don't know, it's just been interesting with the governor, but it's his, I mean, it's definitely his thing. He's gonna keep pushing, and he's mad that he's not getting his way right now. Jimmy Durant has been pushing out regular emails saying, please, if you have the opportunity to reach out to any of your representatives' house that you can talk to encourage them.
Newton supports it.
Yeah.
We've been on, we did a Zoom call with a bunch of us local, or the CEOs from the Northwest, did a Zoom call with Senator Murdoch the other day, and he's still on the fence. He's still gathering information. He has not been in support of it to this point.
Well, and I think the other side of it is they're trying to say that because we're ranked 49th in the state in healthcare, that's the drive, you know, that this company is going to solve that. And some of the information that Jimmy put out as well too was documenting journals that speak specifically to the fact that does not help and has not helped. That they have no proven record that they've improved quality and health factors.
In fact, one of the companies, Centene, one of the companies, one of the 4 companies that he's looking at getting the contract is under fire for bilking states out of a lot of money. I mean, it's in the courts right now. Was it Ohio? And actually, there's a few. There's more than one.
If you looked at the 4 companies we're looking at, in particular that one, that's the one that has the $699 million profit.
Yeah.
I mean, we're all business people. We know how you get to a profit like that. So it's discouraging to say the least, but we're fighting as hard as we can up there against it. And like I said, there's that continual push to try to keep it in front of as your representatives to be sure that our voice is heard in the rural market.
So what they're wanting to do is not outsource it to these 4 big companies, but keep it in Oklahoma. And we're getting, I forget how much federal money, like the $800 million over 4 years.
That's what I was thinking. It was significant.
A significant amount of money, and we want that money to be spent on hiring consultants to help us develop our own system to manage it in Oklahoma, to take care of Oklahomans and not send it out of state to pad the pockets of big insurance companies.
Yeah, I mean, the first step was for us, you know, to get the Medicaid expansion so that we could go get the federal dollars. And I think that's the extra upset in this whole thing is that Oklahoma Hospital Association pushed so hard to get that push, and now he wants to spend those dollars with a third-party company and cut the services and act like it's not going to. It just will. It's just so clear. We can't profit. I mean, there's just no way. So, anyway, just wanted to make sure that
Thanks for bringing that
up. Yeah, absolutely.
When you say cut the services, are you also talking about reimbursement rates? Are you talking, because I know that we had a push 10 to 20 years ago to managed care for Medicaid, and the providers opted out.
And they will, so
And
you
you
know where
couldn't-
they're going to end up.
Yeah.
So they're going to end up in your
the-
ER.
Right,
They're going to end up in the hospital sicker because of,
because you can't get an appointment.
no.
Yeah, no,
And
that's
it's
exactly, that's the other thing he pointed out, that, you know, we tried this 20 years ago and it didn't work, you know. It will be, it'll be a cut in
Right.
reimbursement rates, it'll be a cut of services. I mean, for whatever reason, they feel like they can cut inpatient services. The logic behind that, I don't understand at all. so, but that seems to be the trend and what they're kind of, and they think that's okay. But I don't know. It's, if you ever get a chance to read an article or something, read up on it, because it's very interesting.
There's some
And they
stuff
are-
on my Facebook page I've shared. I'm sure
Yeah.
there's stuff on St. Anthony's.
Mhm.
Sure.
I mean, they are battling it out, and you can share the email that Jimmy sent if you want to,
Okay.
that has a little quick summary of kind of, what they're battling over, and their and the
Stop,
reason.
what is that one, stop healthcare holdup, I think is another email that comes frequently. I'll send you guys some stuff so you can go with it.
And if you do get a chance to be in front of anybody, we would appreciate the extra help behind that, so. On another note, St. Anthony, it has been growing. Like I said, it's been an unusual year for us because we were all tied up in COVID, and Saints has been strategizing for many years and moving forward at an amazing pace, and then it's like all of a sudden we just stopped and had to do the whole COVID thing. But as soon as we had the opportunity to pick back up and move on, we certainly did. And as of April 1st, Midwest City has joined our group. They're wholly owned, so a little different than Shawnee Hospital that is wholly owned as well. But so Midwest City is more like a department of St. Anthony. So when you see the name, it says SSM Health St. Anthony Midwest. So it's like a campus. But they did come under the SSM umbrella. We just had their wall ceremony today to bring them into the group. And interesting enough with that, they, which I was completely unaware of, but they were running an ambulance service for that portion of rural Oklahoma, which I'm thrilled about because we do have several rural hospitals that run ambulance services, and we've kind of been like, oh, we'd like to help you out with that, but we just don't know a whole lot about it, kind of stuff. So the more that we build that service and learn effectively, that we'll be able to help our community hospitals with their EMS services as well. So if you're in the city, you may see some SSM St. Anthony ambulances running around town. We've had ambulances before, but all they did is run back and forth from our health plexus to our main campus. These are actually 911 calls. Yeah, so it's kind of cool. So a lot to do with that campus. Unfortunately, the previous owners have kind of let it go, so there's a lot of work to do. But I noticed they already started some construction, and as Candace Bowles knows, Joe's had them working on the outside immediately. He's all about things looking nice from the outside of the building. So I see that will come along probably very quickly. And we did gain some specialists from that area as well too, some OBGYNs. And the most important thing is that we gained 255 beds, which is the thing that we were super excited about because, as you all know, beds are hard to come by at any given time. So it'll be a good period of time before we, get everything kind of the Saints way. But what it does for our rural hospitals is that it does open up some more beds. Because we definitely have, I would say probably 4 or 5 months out of any calendar year that we are on divert. It has just been happening consistently over the past couple of years. So it gives us additional ICU beds. They're not up and running now, but they will be. Some additional specialists and some additional beds. So we're excited about that. And then we'll be celebrating Shelley Dunn's retirement.
I wondered if that was coming up.
Yes.
When is she?
Her last day is the 30th of May, but I think she has a 2-week vacation right before then. So I think
She's got about 2
effectively,
weeks.
yeah, so effectively she has about 2 weeks left. So
Wow.
she's been a long-standing role CEO with us. So we'll be celebrating that at the affiliate meeting next week.
Okay.
Hoping everybody can get there. We've had 2 retirements. Debbie Kiefer retired from Cordell as well, but we were very blessed in that situation to find a fit. Her husband happens to be a pastor. He got a pastor's job there in January, and she has an extensive nursing leadership background, and she wasn't doing anything. When Deb retired, we were called her up immediately. She was like, yeah, I'd love to do that job. So we got very blessed in that situation. And I think they're close to picking a new CEO for Okeen. So they had over 12 applicants, which was surprising, really. Probably 4 or 5 of them were qualified enough to interview, so that was good. So just lots, like I said, we were kind of in just a funk there for a while, just doing our thing that everybody else was doing too, just trying to get through the COVID situation, and then things started stirring up pretty good. On your cyber stuff, I noticed you were doing as well too. I think I shared with you that Harper County, and they had a cyber attack, so it's out there and it's prevalent, and so we've been trying to prepare our rural hospitals to be sure that they're ready for that, because unfortunately, they were unaware that they didn't have any cyber insurance. Just one of those things we hadn't rolled around to yet. Definitely on the radar now. All the other hospitals likely did, but they did not. So it is going to cost them probably about $150,000 to recover, which is really unfortunate. Really unfortunate. So we're trying to be creative with some of the COVID funding to try to get some of their servers and computers replaced, because it's a very expensive price tag, as you will know, for a small little hospital. It seems like they're hitting those FortiGate and firewalls that most non-governmental hospitals use. I think they're, sold at a lesser price, and so a lot of the hospitals and those, and so they're extremely vulnerable right now. So everybody's trying to gear up for that, because it's well experienced it here, so.
One of the things that we did was blocked all those foreign IP addresses, a lot of them out of California as well, and that took our tax down, pings down to almost nothing.
How would they put that? Why were those there? How were those IP addresses?
I don't know. No, but once he figured out, which IPs, companies, whatever addresses to block, it was nearly nothing.
They did the forensic analysis on this one, and they only entered the password one time. So somehow, some way, and they got hold of that password. They still don't know how. They still have no idea how they got it. But when they did the analysis, they could tell that they had literally put that in one time.
So it wasn't a program running, trying to sniff out passwords.
No, they got a ransom notice and stuff too. It was for $100,000. But it was way, way down in there, and they didn't find it for like 2 weeks. And they had already started rebuilding everything. Yeah, it's pretty scary. I mean, for any industry, but healthcare seems to be a target right now. Okay, that's all.
All right. Well, thank you. We don't have a city council report, however, Greg Bowman will be our new city council representative. So next month, we will welcome him. I just have a good note to share. I received a letter from a patient that had been here in the ER and had stroke-like symptoms and came to our ER, and our ER took care of them and forwarded them on to St. Anthony's. And once they got to St. Anthony's told them that we did everything that we could have done and needed to do for them once they got there to have a successful trip back home when they were released from St. Anthony's. They also had a good experience at St. Anthony's as well. But they wanted us to know that our staff did a fabulous job. They did everything that they needed to do to make sure that she did not receive any further damage along the way. So kudos and pats to everybody on the back, and just wanted to report that. There's no other items of new business, so we are adjourned.